Yes, my friend, welcome once again. Yeah, thank you for coming to Turkey for this procedure. Your case is a little different and important because you have an embolization before, and I think it was 1 year before, right?
Yeah, yeah.
So we have recurrences after embolization because I think it is 70% successful because we have in 30% of the cases external spermatic veins and gubernekular veins, which are impossible to reach with embolization. But in your case, very surprisingly, it was a really surprise for me in the operation. You had also recurrence in the internal veins. I couldn't understand why it happened, but then after now, when I do a controlled Doppler ultrasonography, I can see that you have big arteries, you have big testicles, and that's why the blood supply coming to testis is big. So a lot of blood is coming to your testicle, and when it tries to go back, it's pushing all the vasculature too much. So embolization blocks the vein nicely. They put a coil, and it will block anything. But if there is too much blood supply, and if you have an external vein, somehow they find interconnection in between, and all of them, gubernekular, internal, external, all of the veins recurred. What did you feel? Did you feel pain or fullness? What was your symptoms?
Yeah, I had before and after the embolization, there was no real improvement, but the reason I got the embolization in the first place was because of pain. It was like a discomfort that was there in my scrotum, and even after the embolization, I felt like the pain, it didn't get any better. In some ways it almost got worse, and it could be, I could get it a few times a week. It could last for days. Sometimes it would go away for a few days, very kind of random, and sometimes it was hard to know what, how could I reduce it? So
Yeah.
yeah.
Well, what were you doing to decrease the pain?
Yeah, like just taking painkillers and having cold showers could help a bit. Going for walks. I know what would make it worse would certainly be sitting down in an upright position. That was what made it bad.
Sitting.
Yeah.
It's really nowadays I am understanding all varicocele cases. We were thinking just standing upright, working in heavy things. No, sitting in the across computer also in this sitting position. It's also affecting the testicle. Maybe squeezing the backflow of the blood. So it's making varicocele more and more. So if we have a case like you after the procedure, we will say, okay, you have to wait 3 months and it will disappear. So did they follow you? How was the follow-up after embolization?
Honestly, pretty terrible. My urologist who I originally went to, he handed me over to an interventional radiologist. And my urologist stopped following up with me, and he says, okay, the radiologist is looking after you now. I followed up with the radiologist, I had a phone call with him maybe a month after the procedure. I said, yeah, still some pain there. He says, okay, wait. Then, I was trying to contact him for 6 to 8 months after that, so I had the procedure in July.
He's not experienced in physical examination, right? He can't examine you. He just can do the procedure. But the follow-up supposed to go with the urologist? Is it the way they do?
I mean, that's what I thought, how it would work. Isn't he supposed to be the expert in male anatomy? But he said, look, you're no longer my patient. You just deal with the radiologist now. And this was in a private hospital that's supposed to be one of the best where I'm from.
Actually, it's not a very simple process. If someone can do embolization in a good way, he's an expert, I believe. It's not an easy thing to put this coil inside this vein. But the issue is we follow the patient after the procedure many times, and it's a close relation. I think half of the procedure is ending after the procedure. Just you have to follow, be in touch, and radiologists have no idea how to follow a urology patient. So, but you have been taken to radiologist by your urology doctor. He said embolize. He preferred you. He recommended you the embolization.
Yeah.
Yeah, why he does this? Because normal conventional varicocele procedure sucks. It's really not successful enough. So urologists, some of them, they don't want to operate. After the operation, it's very difficult to deal with these recurrences, and so they are recommending radiologists. But you had also right-sided varicocele. Did they understand it before the procedure? Were you diagnosed with right-sided varicocele too?
I was, yeah, and they said, oh, it's small, so we'll just leave it.
Yeah, actually, we measured the vein, not so small. A moderate varicocele, maybe grade 2. It was not a very slight varicocele. So in embolization, it's very difficult to reach the right side. So usually they do only left-sided embolization, and they don't want to touch the right side. Maybe some of them now using arm. Did you have the embolization from your leg veins?
Yeah, through the groin area.
Groin area. Yeah. So from the arm, for example, right arm, you can go to right side too, but it's more difficult. Left side is more easy, and from the arm, I think going left, it must be a little tricky. So for me, embolization is a really very beautiful procedure, very beautiful intervention, but it has to be spared to those recurrences which open or microscopic normal varicocele, when the normal varicocele recurs, and you are sure there is no gubernekular vein and external vein, there are just internal veins. For example, in my procedures, I take out these external and gubernekular veins, so there will not be an external recurrence. I have a 3% recurrence. When I open these guys, there is no external, no gubernekular vein. It's always internal veins, and embolization will work very nicely in these patients. So the weak points of embolizations are those. You can't reach the right side. You will have a 30% recurrence. Even the internal veins are very successfully treated. Still a 30% recurrence rate for external and gubernekular veins. And if the guy has a very big varicose veins, yeah, it's very risky because your blood supply to testicles are too much intense, too much powerful blood is coming. So the risk of recurrence is high in these patients, I think. So, do you feel any difference now? It's third day after the procedure. Is it possible for someone to come from a European country here and go back? How do you feel? You will go back, I think,
on Saturday.
On Saturday, yeah. Today is Thursday.
Thursday, yeah.
The next day after tomorrow, you will go.
It's day 2, yeah. So it's I feel I have pain at the incision site, of course, but I don't have any varicocele pain, which is good.
Can you differentiate the pain related to varicocele is not present now?
I think I can. Yeah, it's a very distinctive thing that I've known for a few years, and it's not there at the moment. So. Yeah. Hopefully it stays that way.
Yeah, that's what I like about this procedure is instantly after the procedure people say, oh, I have a pain, this is promising, but the pain has gone. This is not the same pain, so it's really very relaxing and enjoyable for me to hear this because the vein, we take it out and the pressure inside, there is no vein. So sometimes people ask me, you are taking the vein out, isn't it harmful? No, this vein is harmful. Everybody tries to get rid of this vein. They try to ligate it and pray, hopefully it will disappear. Sometimes it disappears, sometimes not. But I take it out. I do it in the way that vascular surgeons do. When they operate for leg veins, other veins, they do it this way. They recommended me to do that way. So it's not harmful, it's working, and just instantly after the procedure, as you feel, the patients feel it is gone. Yeah, I wish you a very good recovery, and I hope it will never come back again. Thank you for this video. And everybody hesitates. Is it possible to come from another country? So really half of my practice is nowadays from other countries, and the main thing I operate is varicocele, and in ladies these cystoscopies. This is also difficult. You know, people come from other country, they hesitate if it's possible to do it. Yes, it's possible. Yeah, thank you.
Yeah, thank you,
I
doctor.
wish you a very nice healing.
Yeah, thank you. Yeah.
Thank you. Yeah. Please stop it.